So the Center for Telehealth is a program at Mass General that supports a number of different clinical interactions. Our largest program, and the one that we first got our start with back in 2001 was when we officially went live, is the telestroke program, providing neurology clinical care to about 30 different hospitals in the New England area. But then we also developed and support a number of programs within MGH. So the virtual visits program, which now in 2020, a lot, maybe most of our patients are very familiar with, allows doctors and patients to interact via video conferencing so that they don't need to be on site at the same location. And this year, as part of our COVID response, we also launched a new inpatient video conferencing platform, which, as you said, was known as VIX, the video intercom communication system. And that was to allow our unit staff to talk to patients in their room when there may be contamination or precaution risks, so that we could reduce the use of personal protective equipment and allow our patients and our staff to still interact with each other face-to-face, have really easy communication, and to be able to communicate without requiring our staff to repeatedly go into patient rooms when it may not be as safe to do that as frequently as they normally would during care delivery. We started the program back in the winter of 2020 as a response to COVID, when suddenly we did have this need to limit how often staff are going into patient rooms. Our nurses go into patient rooms so many times during the course of a day. And what we found was that when we gave them this tool to allow them to call into the patient bedside and talk to a patient without going into the room, there were way more interactions than we thought might happen at first. So the program was used for lots of different reasons. If the patient would hit the call bell, the staff were able to call the patient back and talk to them face-to-face. They could answer any questions the patient had, as well as bundle together requests, so that rather than taking multiple trips into the patient room, they could put together 5 or 6 different activities and only go into the room one time. At the beginning of the COVID response, that was really critical for us because it allowed us to use less PPE, because a nurse wouldn't have to fully don PPE to go into a room to respond to the call bell, to find out what the patient was looking for, in which case they may then need to leave the room, take off the PPE, then put on another set to go back in. So it was really able to make in-person physical care delivery more efficient. It was also great because it gave our staff a way to check on patients really 24/7 without disturbing them. So while a patient was sleeping, the care team might check in over the course of the night just to take a look, see how they're breathing, see how things sound. It would also allow them to check on things like IV pumps and just take a look at what's going on in the room, again, without increasing our staff's exposure to the virus, and while still preserving PPE. So it was really exciting. We put it together based on a product we had been using in the ambulatory space for a number of years. And it was met with wide success. In our busiest month, we saw about 10,000 encounters, which was really exciting for us. But it is a solution that we put together based on existing tools. So what we're very excited to be doing now is to be looking at how we can prepare for either a future COVID surge or how we can adapt this technology just to use it in everyday care delivery, and really looking at the next generation of the platform. So rather than kind of the rapid deployment that we looked at the first time, we're taking a much more deliberate approach now and looking to see how we can spread this throughout the entire healthcare system, put some really robust support models behind it, and make it so that video conferencing is just part of the everyday patient experience. So if a patient is admitted to the hospital in the future, they might be able to have a video conference with either the nurse right outside the room, if they are, say, on contamination precautions, or they could talk to their PCP from outside the hospital, a consulting doctor from a different floor, or family members would be able to call in as well, so that we can really bring the power of video conferencing that we're today using in our everyday lives into a really structured, well built-in platform that we can have at the patient's bedside. And we're really excited to see how that's going to impact care in the future. Please feel free to visit our website at massgeneral.org/telehealth, or you can shoot us an email at mghtelehealth@partners.org, and we'd love to get in touch.
Thanks for joining us today, Benji. We really appreciate it.
Yeah, thank you both.
Thank you. It's been a pleasure speaking with you.